being sober.
That I ain't being sober. You remember that advice from last week with the self-care? Man, it's told me so much to take my mind off of the stuff that I need to do this week.
I mean, yeah, Reed, but you're lit. And it's the middle of the day, yo, we gotta chill.
Don't you judge me.
Look, it's no judgment over here. Like, I know that alcohol can definitely help us loosen up and get our minds off the things that are concerning us. Shoot, I definitely sip on some bourbon nights after a long day. But we also know that alcohol and drug use can become problematic.
Ain't no problems over here, Ben. I could go to a happy hour, sleep it off, go to work the next day, and be just fine, thank you very much.
I mean, look, I know that the vast majority of us young adults do drink. But if you think we only having one drink inside those red Solo cups at happy hours or parties, you're playing yourself. I mean, more often than not, we're having way more than 1.5 ounces of liquor, 12 ounces of beer, or 5 ounces of wine. I blame that last one on Olivia Pope.
But what if I have a high tolerance? What if I could drink more than other people, Sean?
I hear you, but just because you don't feel like you're faded, or maybe even feel like you can drive, doesn't mean your levels ain't high. And that's why I stick to these herbs, man. Look, these things help me stay so calm and so peaceful without any of the messy consequences.
You think? I mean, all drugs have some sort of impact on us, whether it's response time, our mood, our social interactions, our perception. It's always going to impact us. And, it's just important to remember why and when we desire them.
Yeah, I mean, but I only use them every now and then, right? Like, I don't abuse them. It's not like I'm strung out. And listen, I can stop whenever I want. Plus, every time I turn on the radio, somebody's talking about that double cup or that white or Percocet, Molly Percocet. I mean, it used to be about selling drugs, but now it's all about how, when, and where to use them.
Okay, I get you, but especially for Black folks, even though we use them less and are less dependent on drugs and alcohol, our consequences can be more severe. Just think about the discrepancies with sentencing, school responses, and the public outcry between the heroin and the crack epidemic. Oh, and that withdrawal, you don't want to be that person in that treatment facility. It is not the business.
Okay. I mean, so what are we supposed to do when we need a little bit of something to take off the edge?
Well, a little bit is the key. So you gotta know for legal things, the law around it, and your response to it. Because it's not just about our lives. It's about those around us, those on the road, and those who love us, too.
That's real. And I actually think I'm starting to feel it. So maybe we should just take the rest of the day to recover and get our lives together.
Yes. I'm Reed.
And I'm CT. And this is our Mental Health Minute.
We don't do the same drugs no more. We don't do the same drugs no more.